look in 3D just to have a better understanding of what exactly lies beneath that particular muscle or a bone or something. So you can have a better understanding, your students can have a better understanding what exactly it looks like if you try to remove parts by part of a body. If you have any questions, you can just ask me. If you feel specific questions you have, you can just ask me. You see, I'm trying to remove this, specifically ligaments of this one. Then if I want to turn around, I can have a look what lies beneath it. The image which we are using right now is a full body male. Okay? So there are limitations to it because of the size of the image. Okay? You can remove muscle by muscle, but if you want to have a look at the heart, for example, or a lung, how would the structure of the lung or the brain example, so you have to go on, and another option is high resolution images over here. Okay? In high resolution images, it is when you open a high resolution image, there are different parts is mentioned in it, and you can specifically choose your part which you are interested. Then you will, if you want to have for example, you want to give a lecture on a brain. One more important point, when you are trying to give a lecture, okay, try to come at least 4-5 minutes before and try to open the windows, because since these images are very high, I can say that it's a very heavy images, high resolution images, so it will take time to load on the system. So you don't want to waste time when your students you're giving a lecture. So you can just open as many windows as you want. This is called section tool, cutting tool. Okay, using this tool, we can make a section of any section you like, horizontal, vertical, angle-wise. Currently, I'm using a brain scan, high-definition scan of the brain, so just for you to have an understanding. Once you make a line, you have to use one finger, to slide it. Okay? And now you can see the image of the brain is pretty clear when compared to our full body image. Okay? I like to say you that how you can use this instrument. Okay? One finger you will use for rotation. Okay? 2 fingers is same like pan in a PDF file. You try to move a page. So 2 fingers are used for the pan. If you want to move the image, you will use 2 fingers. And once you have a section, you make a section, and obviously when you make a section, you are not sure that what part of a brain you are interested in looking at, cerebellum or whatever it is. So what you can do, using 3 fingers, you can increase the section or decrease the sections. So I'll show you now how, using 3 fingers, I'm trying to, if you see it carefully, I'm trying to increase the section now. This view will be fine. I'm trying to increase the section now for you to be more specific if you are interested in area of the sinus, what you want to talk about, okay, how your students, or any specific part of a brain which you're interested in. Once you make a section, any sort of section, using 3 fingers, either you can increase or decrease. So if you want to increase it, I'm just trying to drag my fingers downwards. And if you want to make it up, if you want to decrease the section, you just do the same thing, but the fingers should be going upwards. Okay. Now I will talk about the various options you see on the table. Okay. If you be, oh, this is not clear over here. IR technology, you know, infrared technology. So basically, the lines on the corners is like a mesh which is trying to sense which point you are pointing your finger. So what happens is mostly like if 20 students are standing on your table, somebody is touching like this, you can't do much on that because the system is thinking that that is where you're pointing your finger. And you get confused why the system is not working. So the main purpose of providing this screen is like if you have a 50 students class, at once they can have a look of the